All right, good morning, everyone. I went ahead and added your extra credit points to the midterms. If you did not receive credit for that, that is because either you did not address all the incorrect answers, or a shockingly large amount of your corrections were incorrect. If you have questions about that, feel free to shoot me an email. I think there are only a few students where that happened to. So the large majority of you should see that 5 points were added to your midterm score. I also submitted midterm grades. I hate doing that because there's still over 60% of your points not accounted for. So I really feel like the midterm grade is not indicative of what your final grade is going to look like. Pretty much your midterm grade is highly skewed towards whatever you got on the midterm, because when you have to actually do the math, that's like 90% of the grade that's available. The rest of the 10% is just your quizzes. We just haven't submitted the policy brief, which is worth 30%, or your final exam, which is worth another 30%. So if you see a fairly low grade, don't despair. As long as you do well on the policy brief and the final exam, that grade should go up considerably. Like I said, the midterm grade is pretty much almost exactly what you got on your midterm. If you have questions about that, let me know. So just a quick reminder, your policy brief is due on April 9th. And the week of March 29th, so the last week of March, is we're not having class. All we're doing is one-on-one Zoom meetings. But I encourage you to either go ahead and start scheduling that, or if you want to start scheduling that one-on-one meeting starting, this week or the following week, we can do that. That way it's easier for me to fit everybody in for the time that you guys would like. So what I want to caution you against, and this happened to quite a few of you last time, is you waited until the middle or the end of the week that we were having the one-on-one meetings and then requested a very specific time, or even just requested any time and I was already booked. So I don't want to see that happen to you guys. So be sure to go ahead and either start booking for that week, or you can book this week or the following week, so that I can make sure that I get everybody at the time that works for them. Okay. If you'd like to book more than one appointment, that's fine as well. Just make sure again that you're not requesting like 3 meetings at very specific times, the week that I'm trying to meet with everybody. So just be cognizant of the fact that I'm trying to fit in, 2 sections, and I want the time to work for you guys as well. So you might want to try to go ahead and start getting that meeting out of the way. And then that last week before it's due, if you just want to meet with me for a few minutes, I can look over your final draft and let you know what you need to fix so that you can get a 30 out of 30. Okay? Questions about that? No questions? Okay, let's talk about drugs. All right, so on Monday, we talked about the war on drugs and we talked about drug courts. So today, what we are going to talk about is the specific types of treatment that are available. So up until this point, I've been sort of talking about drug treatment kind of in an abstract sense. What I want to do today is talk about the specific types of treatment. So to give you some context, like every time I talk about treatment, I want you to know what kind of treatment is out there. All right, so the way that we refer to these treatment types are treatment modalities. So modality is just a fancy college word for category or types. So the treatment modalities that we're going to talk about this week we're going to talk about detox, methadone maintenance, outpatient drug-free services, and therapeutic communities. And keep in mind, even within these modalities, there are different ways to do this. So especially when we talk about outpatient services, I'm going to be talking about these modalities kind of in a general sense, but just know that if you were a treatment clinician, there are a number of ways that you can approach these treatments, and we're just sort of understanding them in the general sense. So, like I said, a modality refers to the traditional approach used for treating drug dependence in the US. And although drug treatment can be classified as one of the mentioned modalities, as with most offender treatments, there are wide variations with each modality. So, especially when we talk about outpatient services, there are a variety of ways that you can provide that treatment service. So the first two we're going to talk about, and we've got a slide for each one. The first two we're going to talk about are detox and methadone maintenance. Those two generally are not offered in a prison setting. Occasionally, you can see them offered in a jail setting, but usually what's offered in a prison are some sort of outpatient service or a therapeutic community. So when we talk about detox and methadone maintenance, I'll explain how that can be offered in an incarcerated setting, but generally those are things that are offered in the community. So one thing I do want to point out is that when you are treating drug dependence, you kind of have to treat two addictions. You have to treat the physical addiction to drugs, and you also have to treat the mental addiction. So the physical addiction to drugs can be dealt with through detox and methadone maintenance. But if you don't deal with your mental addiction, which is basically why you started using drugs in the first place, you're going to slide right back into that drug abuse. So if we deal with the physical addiction and we get you past that withdrawal stage, and we don't help you understand why you started using drugs in the first place and try to foster improvement in that area of your life, even though you have gotten beyond that physical addiction, that mental addiction has not been addressed. So this is why it's really important to sort of fight this battle on two fronts. It's very important to go through this sort of talk therapy so that you can understand why you were doing this in the first place and to try to fix those issues. Because if we get you past that withdrawal stage and then the same situation that drove you to drug addiction is still in your life, you're going to go right back into that. So, like I said, detox, methadone maintenance, those are usually offered in the community, sometimes can be used in an incarcerated setting, but outpatient services and therapeutic communities, that's what we often see as offered to inmates. One little note I would like to make, most people do, or most clinicians do not consider Narcotics Anonymous or Alcoholics Anonymous treatment. That is not treatment. That is a support group to keep you in treatment and to keep you off drugs. But if you look at a prison website or you talk to somebody that works in a prison and they say the only form of drug treatment they have is Narcotics Anonymous, that is not actually treatment. If you talk to somebody that actually does drug treatment therapy, someone with a master's or a PhD, they will tell you that's not actually treatment. That is there to provide a support system. It's an important part of continuing to stay off of drugs, but that is not going to help you understand your mental addiction. That's what that talk therapy is for. All right, let's talk about detox. So, detox is there to deal with that physical addiction. And usually, detox is given right at the beginning of your treatment. So, detox is only for severe drug addicts that are addicted to a very serious drug and have been for some period of time. The reason that detox is needed is because when you have been using hardcore drugs for an extended period of time, usually several years or up to over a decade, your body becomes so used to living and surviving and working with that drug in their system that if you quit without medical intervention, you can either have a heart attack, you can start seizing, or you become so ill that you are continuously throwing up and in danger of dehydration. This is why we need detox. This is not to get somebody that recreationally occasionally smokes marijuana. They do not need detox. This is for somebody that has been injecting heroin for like 10 years. Their body is so used to that level of heroin that if you quit cold turkey, they often have, like I said, your heart can just stop. you can start throwing up to the point where you get dehydrated, or you can begin seizing. So you need medical intervention and somebody to watch you while this is happening. So detox is the facilitation of drug withdrawal, and you usually need either a nurse or a doctor or somebody nearby that can administer life-saving medical care if you need, or at least hook you up to an IV so that you get enough fluid, so that if you are continuously throwing up, that they can make sure that you don't get too dehydrated. So again, this is only dealing with the physical addiction. So the primary objective here is to provide symptomatic relief to drug addicts, while the treatment staff can work to help to eliminate this physical dependence on drugs. Once you can kind of get over this hump, that first withdrawal from this physical dependence, then you can start working on your mental addiction to drugs. So, if you guys have ever watched Intervention before, after that person has like a complete meltdown and says they're not going to treatment, and then they agree to go to treatment, the first room that, or the first area of the treatment facility that they go to is a detox room. So, you may have seen them like in a dark room on like a hospital bed hooked up to an IV. That is detox. So, detox can happen with or without the assistance of drugs. So what I just described is without the assistance of drugs. So just being hooked up to an IV, being monitored by a medical professional, that is not drugs. An IV is not drugs. So another way somebody can be helped over that withdrawal hump, or even continuing towards that, is with the assistance of drugs. So there is a drug called Antabuse, and it's for alcoholics. And basically, what this drug does is it has like a threshold of like, half a beer or a couple of sips of alcohol. That if you take too much alcohol, if you hit that threshold, it will make you violently ill. So it makes you not want to drink alcohol because you become very sick. Another way that you can use drugs to facilitate detox is, if you think back to the example that I gave you when we were talking about the Veterans Treatment Court. Someone that is addicted to heroin, they can take a drug that counteracts, it makes them not crave the heroin. So that can be used, and that is not Suboxone, which is methadone maintenance. We'll talk about that in a minute. So there is a form of a drug that you can take that curbs your addiction, or that the like sort of itching feeling that you need to get that heroin fix. So that's an example of doing detox with drugs. So taking the Antabuse, taking the name of the heroin drug escapes me, but taking that drug that curbs your addiction to heroin, makes you not crave it. That's a way to continue into detox with the assistance of drugs. So this doesn't usually happen in a prison. It can sometimes happen in a jail. But so whenever you go into a jail, and hopefully whenever this pandemic is over, I can start offering jail tours as extra credit. And if you guys aren't in my class anymore, but you still want to go on a jail tour, I can add you to the special order. So whenever we're back on campus and life has returned to normal, I think a few of you have already been on the jail tour with me from other classes, but if you're interested, I do this every semester once the world is back. So once that happens, if you want to go on a jail tour with my students, just shoot me an email. Anyways, when you come in the jail, one of the first, you go through a couple of rooms, but one of the rooms that you go through, you meet with a nurse or some sort of medical professional, where you let them know that they want to make sure that you're not injured, that you didn't get injured on the way, or that you have like some sort of impending disaster that could lead you to die in a cell. They also want to know if you're on any sort of life-saving medications, like Coumadin, like a blood thinner. Like if you don't take that every day, you're going to have a heart attack. So they want to, get straight with what you need medically. And if you let them know that you are withdrawing from drugs, they will sort of evaluate you and see if you need to be sent to the medical wing to receive detox. But this is not something that they are really looking for. They're only going to send you to the medical wing to receive detox if you are in severe distress. What they are trying to avoid is somebody that just doesn't want to get sent to general population and is claiming that they're, withdrawing, so that they can, go sit in a hospital bed instead. So they will be monitoring your vital signs. It's really easy to tell a long-term heroin abuser. You can tell from their arms, but you also can tell, like, if they've got track marks elsewhere, usually between their toes, sometimes in their legs. My mom is a nurse, and whenever she dealt with a heroin addict, she learned to just ask them, what is the vein that you were using right now? And that's the vein that she would use. So there are, like, when you're a hardcore heroin addict, there are track marks to look for beyond the arms. If you're seeing them between the toes and stuff like that, that might be somebody that you need to monitor for detox, because that's somebody that may start seizing in the cell or go into cardiac arrest and die in custody. So that's the type of person that they are looking for, but it's not like they offer, detox to anybody. They're just going to send you to the medical wing or send you to the hospital. You don't see this in a prison really, because before you go to prison, you've been in the jail. So by the time you're, actually being, getting intake in the prison, your detox period is over. And even though drugs are available in a prison, they're not available in the sense that you can develop a habit like this while you're incarcerated. This is somebody that comes from the street. So we don't really see detox in a prison. It's not really needed. You can sometimes see it in a jail, like I said, if when they meet with that nurse, or if they're dealing with somebody that's there just for a short term and is taking, antabuse or whatever that is, they can arrange to have that given to them while they're sitting, while their short stint in the jail, if that makes sense. But this isn't like an intake question. They're not like, do you need detox? We have a detox room for you. That's not really how this works. Questions about detox?
What was the drug for heroin or whatever that you were talking about?
I forget the name of it. If you just Google it, it should pop right up. But it's not Suboxone. Suboxone is methadone maintenance, which we're going to talk about next. But this is a drug that basically curbs your appetite for heroin, if that makes sense. If you see it, just pop your mic on and let us know, because I forget the name of it. Okay. Other questions about detox? Okay, let's talk about methadone. So methadone is synthetic heroin. So it is basically the same chemical. It's heroin that's made in a chemical lab. And since it has basically the same chemical makeup, it has the capability of reproducing the same effects as heroin. So let me explain how methadone works. So it is federally regulated. And you have to apply to be in a methadone clinic, and they don't accept everybody. So federal regulations, when I was developing this lecture, I was on the federal methadone regulation website. And I mean, I scrolled for like days going through the regulations. But we're not going to cover all of those. The biggest one is that you have to be in treatment for at least 21 days before they will start letting you get methadone. So basically, like I said, we have to address your physical addiction, which methadone will, and we also have to address your mental addiction. So you have to be in some sort of talk therapy program that's usually associated with this methadone clinic for at least 21 days before they will even consider giving you methadone. So let me explain how methadone maintenance works, and I'm going to use a really silly example. So Say you take 5 heroines a day, which I know is not the way that you measure heroin, right? But say you take 5 heroines a day, right? So when you go into methadone maintenance, they want to understand how much heroin you take a day, and you tell them 5 heroines, right? So what they're going to do is they're going to give you 4.9 amount of methadone for like a week or two. Then they'll give you 4.8. Then they'll give you 4.7. So they're basically tapering down the amount of methadone that they're giving you. It's a safer way to detox from heroin because, like I said, sometimes when you quit heroin cold turkey, I mean, your heart can just completely stop. Or you start seizing, or they get severe internal cramps to the point where they're like incapacitated. So this is just sort of a safer, easier way to detox from heroin. We're tapering down the amount that you get. So given that this is synthetic heroin given out by the federal government, like I said, there are very strict regulations to being allowed in this program. The most serious one is that you have to be in treatment for at least 21 days before they're going to do this. They drug test you to make sure you're not doing other drugs. They, want to make sure, that you're not just taking this methadone and then selling it on the streets and then continuing with your heroin. They're very serious about this, and it's easy to get kicked out of a methadone maintenance clinic. And if you get kicked out, the chances that you're going to be able to get back in are slim to none. So the amount of time you spend in methadone maintenance varies widely. So it really varies by the individual, how many heroines a day they were taking to begin with, how serious their addiction is, how well they're progressing with that sort of talk therapy to deal with their mental addiction. But the average amount of time that you spend in methadone maintenance is about 12 months. So obviously, treatment goals do not include abstinence from drugs since they're giving you drugs. But what they are doing, they're giving you this methadone that they're tapering down, but at the same time, they are having you go through talk therapy to address your mental addiction. So, what they're trying to do is help you understand the root of your problem. And they also want to help you focus on improving other aspects of your life and your social functioning so that you can live a productive life after this, right? So if you're continuously hanging out with a bunch of junkies in a crack house, they want to try to get you housing and more pro-social people to hang out with. Because if they get you clean from methadone, but you go back to a crack house full of junkies, that methadone maintenance was all for naught. So they want to try to improve your social circumstances and your life circumstances so that this treatment sticks.
Dr. Hill,
Yes.
so does that mean that they're like methadone maintenance treats for physical and mental
Methadone,
addiction?
yes. So, but if you're using the word methadone maintenance, most people would just, that in and of itself is the physical, but there is a treatment center attached to that clinic, or they're giving you referrals to another clinic. So methadone maintenance itself is the physical, but you have to include the mental with it to be able to be a part of that physical one, if that makes sense. And the way that they provide this, varies widely, as with everything in the criminal justice system. Like I said, they might have, great federal funding, or, they might have federal funding to provide the methadone clinic, but be able to apply to state funding to attach a really nice, talk therapy center to it. It really just depends. But the federal regulations say that you have to be in treatment for at least 21 days before they're going to give you this legal heroin, basically. So, like I said, they're kept in the program as long as they need it. The average is about 12 months. And most studies have found that evidence is kind of mixed on this. Most studies have found that it appears to reduce the use of drugs while they're in the program. After they leave the program, if they haven't solved all of those social functioning, issues, it's very easy for these people to slide, back into that lifestyle, which is why they try so hard to get you set up before you leave this. But the type of person that needs methadone maintenance, this is a tough one to get clean. These are people that have been hardcore heroin users for 5 to 10 years. We know relapse is a part of treatment. So, this is a step in the right direction, but this is not, a solve it all for someone that's highly addicted to heroin. And I'm not going to say that these people don't abuse it, because they definitely do. That's why the federal government watches them so closely. They're supposed to take their methadone while they're in the presence of the clinic, but if they try to cheek it, like that guy did the Suboxone in the jail, like you cheek it and then you spit it out and sell it on the street. I'm not going to say that doesn't happen, because that definitely does. There are safeguards in place to make sure that that's not happening. And if they catch you doing that, you're out of the program. So in the other class, we had a couple of questions about whether methadone was a good thing or a bad thing. And I had a student pull up the critics website, which I then, we had some questions about the validity of the author of that website. But what he was concerned about was if you're addicted to heroin and then you go to a methadone clinic and then you get addicted to methadone, does it just continuously loop through this? And the way that I explained it is that heroin and methadone are basically the same thing. So it's not that once you start taking methadone, you become addicted to a new substance. It's the same heroin addiction that we're then trying to taper down. So taking heroin isn't like taking methadone is, it is possible to get addicted to methadone because it has the same effects as heroin. But someone that is addicted to methadone is a heroin addict. It's chemically the same substance. So the way I explained it is that if you are properly in treatment under a doctor's care, being given methadone the way it is supposed to be received, being tapered down, you should not get addicted to you should not get addicted to methadone, because you were addicted to heroin in the first place. So if you relapse and you start using that, methadone for bad, it's not that you're addicted to methadone itself, it's that your heroin addiction has not been solved. That being said, you can get methadone on the street, and if you start taking methadone, you can become addicted to it because it is heroin. Generally, what happens if you can get your hands on methadone, you get addicted to methadone, you will eventually graduate to injecting heroin, because it's a lot easier to get heroin on the street than it is to get methadone, because methadone is so highly regulated. And I have talked to a lot of heroin addicts, and they will always pick the hardcore street stuff over methadone. They will take methadone if they can't get their hands on the heroin. So heroin addicts are always chasing that first high. The first time you get high is always your best high, and then you are continuously doing more and more heroin to try to reach that same high, which is impossible. Which is why it's so easy to overdose on heroin, because you're constantly trying to get more and more so you can hit that same high. But your body develops a tolerance, which is why we need detox. It's amazing how much your body can ingest and continue to survive. And I don't want to say thrive, because these people aren't thriving. People that's, the critics that say like you shouldn't be giving it out because methadone is addictive, I mean, they're right. The point is to do it in a controlled environment under a doctor's supervision, but it's naive to assume that people aren't going to abuse it. It does happen. But I just want you to be clear that if you start methadone maintenance, you don't then become addicted to methadone, because it's the same thing as heroin. It's the same problem. You've been addicted to heroin this whole time, and we're trying to use methadone to taper down your addiction, if that makes sense. The last question that my student in the other class had was he found an article that said that it's easier to overdose on methadone than it is on heroin. And that is absolutely true. And let me explain why that is. Methadone is in a pill form, right? So especially someone that's not familiar, if you've ever looked at, a prescription pill, there's always a series of nonsensical numbers on the top of it. And it doesn't usually tell you the amount that you're like, to see the milligram or whatever is in that pill, you have to see the bottle. It doesn't tell you on the pill. So especially if you're unfamiliar with the amount, you can easily overdose on methadone. You take 2 pills, that could be way too much. You could take 1 pill, that could be way too much. You should have only taken 1/4 of a pill. When you're injecting heroin, you inject it and then you're incapacitated for a period of time. So it's a lot easier to stuff a bunch of pills in your mouth than it is to continuously inject heroin. So yes, it is easier to overdose on methadone, but the way that happens is if you were using methadone recreationally, not under a doctor's care, which is methadone maintenance, you're supposed to be under a doctor's care being given a very specific amount, if that makes sense to everybody. We got that? Okay. Questions? Any other questions about methadone maintenance before we talk about outpatient?
Dr. Hill, I have a question.
Yeah, what's up?
So you said it can be accessed on the street, right? The methadone can?
Mm-hmm.
If it doesn't do, the patients in the methadone maintenance treatments, how do they get onto the street if it doesn't happen often that they get it into like prisons and stuff? Or not prisons, jails and everything.
So they can cheek it. Like I said, they just hide it in their cheek. And because what they do is they give it to you, and they do the same thing in a incarcerated setting. Whenever they give you a pill, even in a mental hospital, they give it to you. You're supposed to drink water and then open your mouth so that they can see that you've taken your pill. But if you hide it in your cheek, you can then leave the methadone clinic and spit it out and give it to somebody else. More commonly, what happens is somebody on the inside is smuggling it out, or somebody breaks into the methadone clinic or a pharmacy and steals it. That's how you can find it in bulk form in the community. Does that make sense?
Yes, ma'am. Is it not under guard or something with it being federally regulated?
I mean, or if you're asking if there's like an armed guard standing in front of the methadone,
not armed guard, no ma'am, but like some sort of security maybe.
Yeah, but like I said, maybe this wasn't the class. Criminals are a lot smarter than people give them credit for. Where there's a will, there's a way. Even during Hurricane Katrina, people were using, they were stealing like construction equipment to bust through the walls of pharmacies to steal stuff. So, like I said, especially the amount of money that you can get for flipping Suboxone on the street. Where there's a will, there's a way. You can bribe somebody in the pharmacy or somebody in the methadone maintenance clinic. Or if you're involved in gangs, a lot of times what they'll do is threaten your family members and you'll start smuggling it that way. Or you can find an IT genius and get them to help you get past the security system. Does that answer your question?
Yes, ma'am, it does. Thank you.
Yeah, so it's possible. People can make a lot of money selling and trafficking drugs. So there's like I said, where there's a will, there is a way. All right, other questions about methadone? All right. Let's talk about outpatient drug-free programs and then we'll call it a day, okay? So this is probably the most common approach to treatment of drug addiction. So now we're moving past sort of the physical addiction, and the rest of the treatments we're going to talk about, the modalities we're going to talk about, address the mental addiction. So roughly 60% of drug abusers who are in treatment are in some form of outpatient drug-free programs. So outpatient drug-free just means that you do not live in the facility where you are receiving treatment. You are physically going to a doctor's office, or these days you are using Zoom to go to a doctor's office. This can be offered in prison or in the community. If you're in the community, you just either are using Zoom or your car or the bus or getting a ride or your bike, whatever, to go to a therapist's office to receive treatment. If you are in prison, you are living in the general population and you are going to the therapist's office on the prison grounds, once or twice, 3 times a week, whatever. All of that is considered outpatient drug-free programs. So anybody that is an expert in this field, probably some of the professors in the psychology department, if any of them focus on drug treatment, would be furious that I am cramming all of the different types and varieties of treatments into one. Just know that outpatient drug-free, there are so many different theories and specific programs and ways that you can go about doing this. Different, you could even use hypnosis as one type of outpatient drug-free programs. There are thousands of ways. Cognitive behavioral, family therapy. There are thousands and thousands of ways to do this, but just for our purposes, since we only are spending a week on this, for our purposes, outpatient drug-free just means that you don't live in the facility and you are going to speak to a therapist in their office. This can be offered in an individualized setting, so it can be a one-on-one, you and the therapist, or it can be in a group setting, so it's you and a bunch of other drug addicts chatting together. So it's like I said, I am casting a very wide net over what we are considering outpatient drug-free. It's just talk therapy of some sort where you don't actually live in the facility. That's what I mean when I say outpatient drug-free programs. So like I said, a lot of variety in the way these programs are implemented. It can be anything like very demanding daytime therapy to more relaxed group therapy programs. But really what we're trying to understand here is we want to know what about your life circumstances fostered this drug use. So that's the first step, is why are you doing these drugs? What happened in your life that pushed you towards drugs? So you start with that. And then what we're trying to do, once we understand that, we're trying to counsel and train them to improve their social skills or be able to improve the circumstances that led to this drug use. So a really common one is family circumstances. So a lot of reasons why people, not a lot, but a large majority of people that become drug abusers, it stems from family issues. So understanding what those family issues are is the first step. And the second step is to figure out how we can move past this, what we can do to improve these circumstances, whether that be, having family therapy together, so having therapy with you and your family, or if it's so toxic, we need to talk about maybe like creating some sort of, we don't want you talking to this person anymore, so that we can keep this person out of your life. So this is the main difference between these detox and methadone maintenance programs. Those deal with the physical addiction to drugs. Outpatient drug-free, those are dealing with the mental addiction to drugs. We are trying to figure out why you were using drugs in the first place and to turn your life around, give you the tools available or possible to move past this. Because like I said, if we solve your physical addiction to drugs, but we don't solve the mental, you are going to slide right back into that. All right, questions about outpatient drug-free programs?
Can these be used with methadone maintenance or something other?
Yeah, so remember I was saying you have to be in treatment for at least 21 days. It's this type of treatment that they want you in. So that they want to prove that, you're really serious about getting clean, that you're not just, enrolling in methadone maintenance so that you can get, free heroin from the federal government. Other questions about outpatient drug-free programs? All right, well, let's end here for the day. And on Friday, we will talk about therapeutic communities, which is the sort of residential programs available in prison. And then we will talk about the effectiveness of the programs available in prison, and we will talk about the effectiveness of the programs available in the community. So, like I said, don't forget to start thinking ahead about scheduling an appointment with me to work on your policy brief. Let's go ahead and start scheduling these appointments, this week and next week. That way you are more likely to get the time period that you want. And that also gives you time if you want to go ahead and finish your draft up and have me look at your final draft. We should be able to squeeze that in before it's due. So when I meet with you guys in the next few weeks, what I want to see is, so remember I set you up, we found your 5 articles and I showed you the information that you need to get from all 5. What I want to be checking is that you have your correct research design, results, limitation from each of those 5 articles, and that the policy implication that you've created based on those results is correct. So that's what I'm going to be looking for when we meet again. Once I've double checked that, then what I'll do is set up a template for you so that you know exactly what needs to go in each section, and I will have them in order for you. Okay. If you are already past that and want to move on, make sure you're following that step-by-step guide. It literally tells you exactly each step and where to find them in each article. So don't forget to go ahead and start emailing me. I can get your appointments on the books and you will be more likely to get the time that you want. Okay. Everybody have a lovely St. Patty's Day, and I will see you guys on Friday.
Hey, Dr. Hill.
Yes.
Hey, sorry. I was late to class. I was in getting my COVID shot.
I got mine yesterday too. Your arm is gonna hurt like a bitch starting
I heard
tonight.
that.
Yeah, I can barely lift my cup.
Oh, great. Well, I did my left arm. Luckily,
That's what I did too. Yeah.
So I missed the first 20 minutes. Could I get the recording?
Yeah, of course, definitely.
Okay. Yeah, I was like terrified of getting the shot, and I saw these 2 old ladies in the park near where I live talking about it, and so I stopped and asked them if it hurt when they got the shot, and they're like, no, but afterwards.
Yeah, it didn't hurt to get it, but my arm is so I got mine at 3:00 yesterday, and by like 7 I was like starting to feel feel it. Yeah, but it's not any different. Like if the flu shot, it's the same pain.
Okay.
Yeah.
Great. Well,
Yeah.
I'll go home and get work done before that happens.
Yeah.
Thank
All
you.
right. I'll go ahead and upload the video and send it to you.
Okay. Thank you so much.
All right. See you later.
Bye.